I'm just going to run a short introduction, and we're going to do this as a conversation. So if you guys have watched any of Trump's press briefings, usually Trump asks stupid questions and Dr. Birx gives smart answers. So I have Liping here from our research department, and she will give the smart answers. But first of all, I would like to thank our panelists, and particularly the ELSA team, Professor David Lamanto and Dr. Asim from NUH. This is a collaboration of us, and also with Dr. Sabrina from Sengkang General Hospital. I'd just like to thank them, and of course I would like to thank all of you for taking the time and dialing into this webinar. So, Liping, can you just tell me, what is this thing called surgical smoke?
So surgical smoke is actually smoke that is produced when tissue is burned in a surgical procedure. It's burned by ultrasonic instruments, laser instruments, and electrosurgical instruments. So it's actually made up of 95% water and 5% cellular debris. And the amount and content of the surgical smoke actually differs based on the type of tissue that's being burned and also the type of energy devices that's being used. So the mechanism of it is actually, is basically just heating the tissue to the point of boiling and until the membranes rupture and then disperse fine particles.
And is all this surgical smoke of the same nature? Or?
So, like I said, so depending on the device that is being used, so for example, if you use cautery, the particles tend to be smaller and would get deposited in lower in the respiratory tract. So for example, the small particles that's produced might get deposited in the pulmonary parenchyma. And usually for these kind of particles, surgical masks are usually insufficient to filter them. So it's always recommended that high filtration masks are being used instead.
So a normal surgical mask is not enough. Yeah?
Unfortunately not.
Interesting. Now tell me, Liping, why is this surgical smoke so dangerous?
So besides the water, there are many multiple chemical components that are found in surgical smoke. And some of these components, such as your acetal aldehyde, your benzene, they are known to be carcinogens in humans. And also there are also other mutagenic particles and also particles that can be easily absorbed through inhalation.
And that's really true? Like, do you have any proof for this? I think Singaporeans would say, real or not?
So yes, so there are actually two articles that I found that shows that there are these chemicals that are present in surgical smoke, and not only that, these chemicals were eventually found in patients, such as they were detected in patients' urine after the procedure, or also in the peritoneal cavity after a laparoscopic procedure.
Okay, so you do have proof. Now this surgical smoke, can it make people in the operating theater feel uncomfortable?
So if I were to look at the survey that was being conducted in Thailand, so there was this survey that was done in Thailand where multiple proportion of OR nurses were interviewed for any symptoms that they experienced after prolonged exposure to surgical smoke. So actually a large proportion of these nurses actually complain of headaches, sore throat, coughing and sneezing after they found themselves working in the OR for longer periods of time.
Interesting. Sounds pretty uncomfortable. How about virus and bacteria? Can they also be found in the surgical smoke?
So viruses and bacteria, yes. So there are these articles as well. If you're interested, I've just shown them over here. So there are multiple reports of viruses and bacteria being detected in surgical smoke after various surgeries have been done. So if you're interested, feel free to have a look.
Okay. And since everything's about COVID-19 nowadays, how about COVID-19? Can it also be found inside the surgical smoke?
Well, I would say even though there hasn't been any concrete scientific proof and evidence around COVID-19, but I think it is safe to say that if we are able to pick up viruses like HPV, the chances of us picking up viruses that cause COVID-19 would be pretty high, I would think.
Interesting. And nobody's ever put up any rules if this smoke is so dangerous? There's no law, there's no fine. I mean, here in Singapore, we even have a law in the fine for not flushing the toilet. But there's no law not to inhale surgical smoke?
So unfortunately, over in this region, there are no laws that make evacuation of surgical smoke in operating theaters mandatory. But there are various societies from different countries that have actually put out recommendations for operating personnel to either don on PPE or also have some sort of smoke evacuation in operating theater just to remove all these surgical devices and also their harmful properties.
Okay. Thank you so much, Li Ping, for all this good introduction. For everyone that is online now, I would like to let you guys know that we are also doing a poll. So the poll is open now. You should be seeing it now or in the next few seconds. Whatever you share with us in the poll, we would like to know who you are and what is your experience in this COVID times, and particularly about smoke evacuation. So please give us your answers along the way, and we will discuss and share the result with you at the end in the Q&A session.